this chemotherapy, which is a potent and powerful weapon against cancer, is known to cause numerous side effects, among which the effect which it causes to the brain and the effect it causes to the cardiac tissues are vulnerable, because it will ultimately lead to the reduction in the quality of life, leading to increased morbidity and mortality. One second. Sorry. Sorry. Yeah. So this chemotherapy is known to cause multiple effects on the neurons as well as the cardiac tissue. So almost all the chemotherapeutic agents which is being used to treat breast cancer have been shown in multiple clinical trials that it is known to cause cognitive impairment, as well as it will cause reversible as well as irreversible cardiac morbidities. So ultimately, this will lead to a reduction in the quality of life of the people who are undergoing this chemotherapy. Yeah. So there are multiple longitudinal research which have been conducted in cancer patients, especially in the survivors, which has shown that this chemotherapy-induced cognitive impairment is known to affect the participants or the patients even before starting chemotherapy. As Dr. Raghavendra sir has mentioned, like the stress component which is there in terms of diagnosis, that stress itself is known to cause mild cognitive impairment as well as certain cardiac dysfunctions in the participants before starting the treatment. And during the treatment, when the patients are undergoing chemotherapy, about 50 to 70% of patients are known to have this cognitive impairment. And multiple studies have shown that even after 10 years of completing the treatment of chemotherapy, about 1 in 3 breast cancer survivors are known to have this cognitive impairment, which needs to be addressed with full efficiency. So if you could see, the prevalence is higher. This prevalence it might be much more higher because the self-reported experiences, what the participants are telling, is even more higher than the objective measurements such as the neuropsychological test batteries which is being used. So the test batteries are not that much efficient to capture the cognitive impairment, but subjectively if you ask, the patients are really having the problem. And this chemotherapy is known to cause direct cardiotoxic effect. It can affect the coagulation system. It can produce arrhythmogenic effects. It can disturb the neurocardiac regulation, which is the autonomic imbalances it can produce, and also leading to myocardial inflammation, ultimately leading to cardiac dysfunction. And even literature suggests that in a long run, the death which will happen in these patients who are survivors of breast cancer is mainly because of the cardiovascular causes rather than the tumor recurrence itself. So it is of a vital area which we need to address or we need to produce some kind of intervention or an adjuvant approach during this phase when the patients are undergoing this treatment, so that we could able to prevent them from having any kind of consequences related with cognitive as well as cardiac dysfunction. So the question arises is there a way where we could able to mitigate this cognitive impairment and cardiac dysfunction which might happen because of this chemotherapy induced side effects? So this is which triggered us to look into the integrated effect of yoga therapy on cognition and cardiac function in breast cancer patients who are undergoing chemotherapy. So we have done a randomized control trial with the sample size of about 75 people in each arm. So we have used a MOCA, which is a screening questionnaire, to look into the participants whether they are, before starting the trial, whether they are normal and they are not having any cognitive impairment at the starting level. So participants who are scoring above 26, which are considered to be normal, and who are even at the range of MCI, mild cognitive impairment also were being included, because studies have shown the stress itself or the diagnosis of the cancer itself will cause mild cognitive impairments. So we have included both normal as well as MCI participants into a study. And they have been randomly assigned into the intervention arm, which included yoga therapy along with the conventional care, and one more, that is the control arm, were receiving the conventional care. So both the groups were undergoing chemotherapy during this phase. So yoga has been used as an adjuvant approach during this chemotherapy. We are not intervened any of the conventional treatments which is going on. The conventional treatment was going on. Yoga has been just added as a component to the existing treatment what the patients were undergoing. And about 18 weeks of yoga therapy have been given. That is about 4.5 months of yoga training have been given. And assessments have been taken at 2 time points, that is before starting the chemotherapy and after the completion of 6 cycles of chemotherapy. And we have used the assessments related with the measurements which will help us to understand about their cognitive functions, and assessments related with understanding their cardiac functioning, as well as certain subjective questionnaires which help us to understand the quality of life of the participants. So we have used an integrated yoga therapy module. This is a validated module which has been validated in SVIASA, and we have found in participants who are been suffering with cancer, especially in breast cancer people, this intervention has been found to be very beneficial, because cancer is a very fragile disease, and patients are having lot of pain, and they are not they are also undergoing a significant amount of pain. So stretching their body or going for inverted poses or going for any kind of like dynamic poses is not easy for them. So we have tailored the practices which could be very easy for them to practice, especially focusing on the breathing exercises, meditation and relaxation, as well as some practices which deals with the chest opening, as well as some form of mild stretching practices have been we have used it. And the intervention have been given in 2 modalities. So we have given in the in-hospital, that is in-house services have been given, where 1-to-1 yoga sessions have been conducted for the participants. So before starting the chemotherapy, for about 3 to 4 days, the yoga sessions were given to them. And once they go back home, they have been given with the video, demonstrated video CD, where they used to play it in their home and they were practicing it. Their complaints have been checked by means of doing random video calls to them with their consent. Also, we have used a complaints tool which is called Yoga Performance Assessment Scale, which help us to understand whether the participants were really practicing or not. So the scale have showed us like all the participants have given a complaints of about 97%. So I am also really surprised how people were giving this much complaints, because I have worked with multiple projects before doing this. I have worked with allergic rhinitis projects, I have worked with migraine, but this is the one group of participants where they have given their utmost belief and their utmost importance to the practices, because these are the patients who are at the brim of their life, because they are not very sure what is happening to their upcoming days. They are really worried about their future health, about their quality of life, everything. So that is one important component what I could able to understand even from the patient feedback what we have received it. They have a lot of belief in this kind of complementary approaches. So the kinds of intervention needs to be incorporated into the regular adjuvant approaches when the conventional treatments are undergoing. So we have given supervised yoga sessions at every cycle, before starting every cycle of chemotherapy, and during their home they have been practicing with the video demonstration, and the yoga performance assessment scale have been assessed on all the time points, and we have taken an average how it been. So these are the tools what we have used to assess their function. We have used heart rate variability, which is a measure to understand their autonomic dynamics, how their sympathetic as well as parasympathetic system is functioning. We have also used 2D echocardiography, because the chemotherapeutic drugs is having the cardiotoxic effect, and it can affect a patient's as well as patient's physical, that is the structural changes also it can produce on a longer run. So we want to understand the dynamics about the heart, And we have used serum cortisol, as Dr. Raghvendra sir has mentioned, like stress plays a vital role in aggravating the problem which is already existing. So we want to understand how yoga could able to mitigate the stress by means of objectively assessing the serum cortisol. And we have used serum BDNF. This is a very good biomarker, that is brain-derived neurotropic factor, which has been linked with neuroplasticity. So regular practice of yoga have been showed in multiple studies that yoga can improve a person's BDNF level, which in turn be correlated with the plasticity of the brain. And that plasticity of the brain can be linked with the cognitive upliftments. And also we have used the neuropsychological test batteries, in which we have used about seven neuropsychological test batteries, which help us to understand about the 5 domains of the brain, which have been already shown that these domains are known to be affected in patients who are undergoing this chemotherapy for breast cancer, especially who are using the regimen called anthracycline. And also we have used certain quality of life measures, because quality of life is the one which is really affected, in which we have used perceived stress scale, URTC and FATCOG. So FATCOG is a questionnaire which is exclusively used for cancer people in order to understand their cognitive abilities. And when we go into the results, we could able to see like the participants who are performed yoga have shown better neurocardiac, that is neurocardiac regulation. That is their sympathetic nervous system activity have been modulated well. So here you could able to see people who are in the control group, before starting yoga, they are having mild form of stress. They are not completely normal. They had mild form of stress, which has been reflected in the heart rate variability measure, which have shown they have sympathovagal imbalance. After undergoing about 6 cycles of chemotherapy, their stress levels, that is the sympathovagal imbalance, get highly disturbed. And when we could able to see in the yoga participants, this sympathovagal balance, which was disturbed in the beginning, was almost came to a modulation. So whatever has been there in the before starting chemotherapy, almost everything remains the same. So here we could able to see yoga has not uplifted anything, but it tried to preserve what is there already exists within us. And the further, when we have checked about the echocardiography, so echocardiography wise, we could able to see yoga helps in reducing the systolic as well as the diastolic blood pressure significantly, whereas in the control group, there was a significant improvement in this blood pressures. And when we look into the structural changes, looking into the left atrial diameter as well as the LV end systolic diameter or LVEF, we couldn't able to see any significant results, because when we look into the literature, we could able to find these changes, that is any form of structural changes which we need to observe, it requires sufficient amount of time. So within 4.5 months, we can't able to observe any changes, but we are in the track of doing a follow-up. So all the patients have been in the pipeline where we are continuously monitoring them. So in the future, when I am coming with the next presentations, I believe I could able to see some changes which might be there. And in terms of yoga also, we want to see how yoga is helping protecting their cardiac function, which already exists in them. And when we look into the cortisol levels, like after chemotherapy, the serum cortisol levels have been significantly increased in the control group, whereas in the yoga group, there was a significant reduction is there, which is a very a good sign of our study, which shows that yoga has a significant effect on impacting the stress levels of the participant. And when we look into the serum BDNF, so serum BDNF also have shown there is a significant improvement with the practice, so which is a reflection of the neuroplasticity levels. And in terms of neuropsychological test batteries, in terms of verbal memory, we have seen significant improvement. In terms of the visual memory, using the visual reproduction task, the control group have shown significant reduction in their performances, whereas the control yoga group have shown betterment. So these are the tests in which where time has been involved and their efficacy in performing the task. So we could able to see overall, after 6 cycles of chemotherapy, the performance or the time taken for the participants to finish the task was significantly higher. Whereas a person who is involved with any kind of regimens, especially in terms of yoga, we could able to see the time taken for them and how effectively they could able to solve the problems was significantly higher. So this significant improvements we could able to observe in all the neuropsychological test batteries what we have used, and also in the quality of life measures also we have seen a significant improvement in quality measures. And even in the European organization, this QL, this quality of life questionnaire will help us in understanding the quality of life measures those are the symptoms which are known to cause common side effects. For example, nausea, vomiting, what all side effects a person is expected to have during the chemotherapy or during the cancer treatment regimen. So those side effects will be captured through this questionnaire. And in this questionnaire also we could able to, especially we could able to see there was a significant improvement in terms of reducing the nausea and vomiting. Also the person could able to sleep better. This is a very good interesting thing what we have found. A person who performs good yoga, they could able to sleep better. So sleep is been related with their immune functioning. So good sleep has a good immune functioning, and good immune functioning has a better ability to address the treatment, or how they could able to receive the chemotherapy can be modulated. And this is about my summary. So we could able to see this perceived stress is already there in them. So before starting any form of treatment, this perceived stress is there within them. And when this, to assess this perceived stress, as I told, we have assessed through cortisol, and we have also used the LFHF ratio, that is the heart rate variability measure. These both measures have been significantly correlated with the stress levels. And also we could able to see this cortisol have been correlated with the BDNF. So as the cortisol level increases, BDNF level declines. So if a person is becoming more stressful, the amount of neuroplastic hormones which needs to be produced in their brain is going significantly lower. So if you perform yoga, you will be de-relaxed, and your relaxation levels will help in improving the BDNF levels. And also we have seen this BDNF have shown better performance in the working memory, their attention skills, their cognitive function. And this cortisol has been linked with the, in our study we could able to match it with the fatigue. So more the cortisol levels were there, the patients were feeling more fatigued. So if the performance of yoga with reducing the cortisol could help in increasing. And this cortisol level has been linked with insomnia, and that insomnia have been linked with LFHF ratio, and LFHF ratio have been linked with the quality of life emotion functions. And this LFHF ratio has been linked with the cognitive function. So we got a beautiful matrix how yoga could able to internally link with all the systems, and how it is giving a beneficial approach. And overall we could able to see there is a very good upliftment in by practicing yoga. So almost all the cognitive domains as well as cardiac domains have been improved. And our study has been published already in the Frontiers, and also we have published recently with the integrative cancer therapies, and still we are in the process of submitting the manuscripts for the publication. So in summary, the word cancer, or the diagnosis of cancer itself, will cause lowered quality of life. This lowered quality of life will affect a person's cognition as well as his cardiac function. And when chemotherapy has been added to this chemotherapy will have lot of impact on their brain as well as cardiac tissue. That in turn will have the vicious cycle. So the cycle keeps going on. So if yoga has been introduced as an adjuvant approach, we could able to believe, we could able to show in the study that cognition as well as cardiac function has been interrelated, and that in turn have a relation with the quality of life. So this is what we could able to find in our study. Thank you.